Good evening, everyone. Emotional whiplash for thousands in central Michigan this evening as stay-at-home orders over coronavirus were suddenly turned to calls to evacuate after a pair of dam failures triggered catastrophic flooding. Tonight, record water levels have washed away roads and cars, left homes and businesses underwater, and put some 10,000 residents under evacuation orders. For many, the trauma worsened by the added worry of maintaining social distancing. Our Kathy Park is in the flood zone.
The water came fast and furious. A pair of dams in central Michigan failing, sending water gushing into homes and businesses.
That's the craziest thing I've ever seen.
Massive amount of debris there.
Reducing much of this dam to rubble.
Never thought in my life that the dam would break.
The flooding catastrophic. The governor declaring a state of emergency.
It's hard to believe that we're in the midst of a 100-year crisis, a global pandemic. And that we're also dealing with a flooding event that looks to be the worst in 500 years.
Evacuate the area.
It's a crisis within a crisis. People here are still under stay-at-home orders for coronavirus, but 10,000 were ordered to evacuate. Danielle Hammond grabbed her pets and rushed to the school turned shelter.
We're still under stay home, stay safe. If I stayed home, I wouldn't be safe. I'm not safe anywhere right now.
I'm not sure what we're going to do.
Betty Pankey left too. Floodwaters forcing her out of this senior living center.
The dining room and the kitchen are totally flooded.
The river here cresting at more than 35 feet, a historic high.
This is downtown Sanford.
Entire towns already submerged. Now concerns for Dow Chemicals' main plant, which sits on the riverbanks. The safety of these dams has long been under scrutiny. Federal regulators rated both dams as high hazards in 2018, meaning loss of human life is likely if the dam fails. Tonight, no deaths or serious injuries have been reported, but this community remains on edge, grappling with dual disasters.
Today's flooding broke a 34-year record. Parts of Midland are completely submerged. Experts say that this was so destructive, the geography of the area could be permanently reshaped. Lester?
All right, Kathy Park in Michigan tonight. Thank you. And now to what appears to be some real progress in the search for solutions to COVID-19. Major discoveries at two top university hospitals that could expedite both vaccines and treatments. With more, here's Tom Costello.
Tonight, potential breakthroughs at two of the nation's premier research labs. At Harvard's Beth Israel Deaconess Medical Center in Boston, more evidence that recovering from COVID-19 may lead to immunity against reinfection. Researchers say 9 rhesus monkeys that recovered from virus-induced pneumonia developed antibodies to the virus and had near complete protection when they were re-exposed a month later. That could suggest immunity from a second infection.
Our studies show theoretically that there is natural protective immunity to this virus, and it gives us optimism that these will likely be the case in humans.
The Harvard team also tested a prototype DNA vaccine on the monkeys, which protected them from the virus. Meanwhile, at Emory University Hospital in Atlanta, researchers believe they've discovered the Achilles heel of the virus. It's right there on top of that notorious red hook that we've all seen.
What this means is that this is now an important target for development of much-needed vaccines.
And there's more encouraging news from the Emory discovery. Using blood plasma donations from people who've already recovered, researchers should be able to isolate the antibodies that block the virus, then inject those into people who are already sick. Carl Goldman donated blood after taking 29 days to recover from COVID-19.
And they're speculating that because I spent so long with the virus, that I built up so many antibodies, it's off the charts.
The question researchers are asking, if you've recovered from COVID, how long will you have antibodies that should provide protection?
Will they still be there, let's say, in the fall or next winter if we get another wave of, the SARS-CoV-2 infection? Will they still be around at that point and be able to provide protection?
And we don't know that right now.
We do not know that right now, no.
If the antibodies do provide immunity, then people who have antibodies could have a sort of immunity passport, allowing them clearance to return to work and perhaps even travel. Lester?
Encouraging news there tonight. Tom Costello, thank you. Tonight, parts of all 50 states are now reopened, with Connecticut joining the list, but Americans remain highly conflicted, eager to get on with life, but many still worried about the silent spread. Here's Miguel Almaguer.
Tonight, Connecticut joining the rest of the nation, the last state to begin its first phase of reopening. Shopping malls, recreational activities, and restaurants getting back to business with restrictions.
I couldn't wait. I saw on the news that they were open, and I said, I'm going to go.
But the 58-day lockdown in Connecticut is hardly all lifted, leading to protests outside the Capitol, where salon owners who offered free haircuts say they are being cut out from earning a living.
How are y'all doing today?
While many are excited to get back outside,
About time. People need to be in nature and see people.
a new poll finds more than half of Americans fear a new spike in COVID cases as restrictions are eased. With every state in the nation now partially reopened, closures drastically vary. This week, Alaska is open for all business, but in Hawaii, the governor just extended a 14-day quarantine for tourists arriving on the islands through June. Locals finally allowed back on their beaches.
People are social distancing, we're getting to enjoy the beautiful weather, and I couldn't be happier.
6 foot, please, 6 foot.
As more casinos press their luck and a small Disney theme park opens in Florida, tonight troubling news from Chicago, where 2 employees at a reopened Ford assembly plant tested positive for coronavirus.
Unbelievable.
Just ahead of the Memorial Day weekend, Boulder Creek in Colorado is now closed after large crowds violated local orders. And as more airlines report a spike in new bookings, there is growing worry over quarantine fatigue on a holiday marking the unofficial start of summer.
Party is an extraordinarily bad idea, and we would ask everyone to hold off on any kinds of parties or large gatherings.
While cities like Los Angeles are hoping for a larger reopening on the 4th of July, there is growing concern an anxious public won't wait that long. Lester?
Miguel Almaguer tonight, thank you. And one of the urgent challenges in the days and weeks ahead is convincing people that it is safe to use public transportation to get to work and safe to get on a plane again. NBC's Gabe Gutierrez now on the aggressive new steps being taken to protect us.
In the first pilot program of its kind, New York City's MTA is testing these ultraviolet lights to zap coronavirus on its trains and buses.
It's been known for more than 100 years, in fact, that UV light is incredibly efficient at killing both viruses and bacteria.
These UV rays are so strong that disinfecting will happen when the trains are out of service without passengers. Research shows the virus can live on a subway seat for up to 72 hours. Weeks ago, this system began shutting down overnight for deep cleaning. This is the next step. Critical to reopening the economy, experts say, is assuring passengers that transportation is safe, both underground and in the air. More airlines are announcing new safety measures. To enforce social distancing, Delta will limit planes to 60% capacity and add more flights if needed. Today, United announced it's teaming up with Clorox and the Cleveland Clinic to deploy electrostatic sprayers, disinfectants, and wipes at its hub airports, as well as mandatory face coverings and touchless kiosks. United is also letting customers switch flights for no fee if they're too full.
We are notifying them of any flight that we think might be over a 70% load factor. And by the way, it's a very small percentage of our flights we're running at 30% load factor.
On the road to recovery, Uber drivers are also installing plexiglass dividers to stay safe. So are some bars and restaurants. And this Miami-based company is cranking out a drop-down plastic shield, like a projection screen.
They're presenting it to schools, to hospitals, to banks, anybody that has a reception area.
In the war against COVID-19, the new weapons are clear. Gabe Gutierrez, NBC News, New York.
Tonight, the virus is spreading faster in Brazil than anywhere else on Earth. The death toll soaring and that country's president downplaying the threat. NBC's Bill Neely is there.
Every day at Brazil's biggest cemetery, dozens of coronavirus victims are buried. Thousands of new graves already dug. The virus spreading faster in Brazil than anywhere on Earth.
Here at the epicenter, they're warning that the whole health system could collapse within 2 weeks. This hospital, one of the biggest, is full.
This is the number of cases?
At the Disease Control Centre, they monitor infections, but doctors say there's so little testing, the real number of cases could be 15 times higher. Brazil's president, asked about the rising death toll, said, "So what? I can't work miracles." Many support his call for lockdowns to end. People want to work, he says, and need to support their families. President Bolsonaro is no fan of social distancing.
It's almost a crime. It's a crazy thing. It is completely crazy. We have right now a war with two viruses, the coronavirus and Bolsonaro virus.
Brazil's leader is an open admirer of President Trump, who says he's considering a travel ban on anyone from Brazil.
I don't want people coming in here and affecting our people.
Officials warn Brazil's cases haven't peaked yet. Mass graves now being dug day and night. Bill Neely, NBC News, Sao Paulo.
I'm Richard Engel in Mexico City, where the Juarez Hospital is near capacity. Dr. Luis Gorodo runs the COVID ICU.
They're all men, and they all seem to be in their 40s or so?
Yes, about 40, 50 years.
Compared to other COVID ICUs I've visited, the patients here are much younger. Doctors say what pushed them into critical condition was COVID combined with pre-existing conditions like obesity, diabetes, or smoking. Upstairs from the ICU, Dr. Gorodo took me to the recovery area. All women getting better. Guillermina came in on Saturday. Her husband is a carpenter. He recently risked taking one job to feed their kids. He and his wife both got sick. Guillermina will go home soon. I feel much better, she told us. Her husband is intubated down in the ICU. Doctors tell us Mexico's poverty means COVID won't go away quickly.
Do you think you're going to see another wave?
Yes, we're scared about the waves because people is not doing the right quarantine.
Since so many people here have no choice but to work. Richard Engel, NBC News, Mexico City.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.